Ports and Harbours Authority, VRA, to mention a few, have been involved in environmental and health challenges following the various mining and industrial operations of the apparent organizations. It is the wish of the association that the Occupational Health and Safety Bill, which we are informed is currently receiving comments from various stakeholders, will soon be laid before Parliament for consideration. This will protect the health and safety of all workers, including especially those in the oil and gas industry. It is our hope that the Ministry of Health will play a facilitatory role in this regard. Finally, Mr. Chairman, GAQHI would like to strengthen the existing public-private partnership in healthcare delivery in this country. In view of our peculiar position of being a quasi government, or should I say a quasi private association, the association would want to take a leading role in organizing a major stakeholders meeting early next year between our sister associations such as the Christian Health Association of Ghana, Society of Private Medical and Dental Practitioners, the Ghana Medical Association, Alternative Health Provider Associations, the Ghana Health Service, etc. In addition, the association would want to see a stronger collaboration between its member health facilities and the other institutions like the metropolitan, municipal and district health management teams in the areas of training and retraining of all health workers, resource allocation, as well as data collection and sharing. Mr. Chairman, I would end by expressing the association's deep appreciation for the support that so far received from the Ministry of Health, and we hope that it's going to be much stronger in the years ahead. Mr. Chairman, Dr. Abia, Head of HR, distinguished ladies and gentlemen, on behalf of the executive of GAQHI, I welcome you to this second AGM, and we wish ourselves a very fruitful celebration. Thank you.
I just want to take this opportunity to introduce to you a guest speaker for the day, the person of Mr. Chicho. He is a board member of GNPC, and he is here representing Dr. Tachuchikata. We invite the guest speaker to make a delivery. Guest speaker, Mr. Chicho, you are invited to the podium.
Good morning, Mr. Chairman, ladies and gentlemen. I am here, I guess, because I was both a student, and I'm a lawyer by training, but I also worked in GNPC for many years as a special assistant in the formative years of the corporation, and I'm now serving on the GNPC board. Almost our entire industrial plant works off hydrocarbons. The entire global transport system, whether it is cars, whether it is planes, whether it is trains, runs on hydrocarbons, oil and gas, ships, and so on. All the militaries of the world are dependent on oil and gas. It has a huge strategic value. Now what that means is that having oil changes our geopolitical position in the world. Gold is an important mineral, but it's not a strategic mineral. Oil is definitely strategic. Once you have the pressures on your society, the pressures to shape how your society develops become intense. Now what oil does for us is one, revenue. Jubilee itself will more than supply our national needs. Everything else above that is export. So there's a direct correlation. Jubilee oil and all the other oil discoveries translate into revenue. That's revenue to the state, which can be used for many things. It can be used to improve agricultural production and efficiency. It can be used to rebuild infrastructure. It can be used to train manpower. to manage our resources better. Okay. It also means energy. And here the gas in particular is important. Gas is a relatively cheap, relatively low cost in pollution terms source of energy. The gas resources that we have allow us literally to transform our energy economy. The rate of discovery has far outstripped the rate at which we are training human resources to step in. And even after you train them, people need to work somewhere to gather the experience to manage and so on. So it's going to take a while before the capacity development curve catches up with the resource establishment curve. That's just a fact. What that means is that there's going to be an even bigger influx of foreign workers. Foreign workers, different lifestyles, most of them, again, are going to be single men, bachelors, rotating in and out 3 weeks, 6 weeks, 2 months, whatever. And the health problems associated with that are different from the health problems that you find in a fairly stable, settled community.
Most of our health-related issues are now lifestyle issues. Most of our diseases are lifestyle. We don't know that cholera is lifestyle, malaria is lifestyle, TB is lifestyle. Yes, most of us doctors have not really realized that all of those diseases are actually lifestyle. We think it's only diabetes which is lifestyle, hypertension is lifestyle, obesity. But as far as I'm concerned, all the diabetes is a lifestyle. Kidney worm is a lifestyle. Cysto is lifestyle. So I'm happy that you have highlighted these points you mentioned so that together we can get engaged and then go to higher level. That's all I just want to mention, and then very much. Thank you very much.
And I'm wondering what policies and solutions have already been put in place, considering that the occupational health bill is even yet to be passed at this stage. Thank you.
As we sit here today, we don't yet have a full suite of regulations in place to deal with those kinds of problems. Okay. It's not that we don't understand the nature of the problems. My personal view is that what happened, for many years, nobody took us seriously when we said there was an oil industry in the offing. And it was very difficult to get policy attention to the needs of the sector. There's a lot of work, however, going on to secure those regulations. There's also a system of contractual arrangements which allow governments to hold, to keep contractors and so on in check. So it's not a disaster, but there's work to be done. There's a lot of interest. The Office of the President has shown a lot of leadership, taken a lot of interest in this sector and in pushing the developments required for it. So there is indeed a lot of work. We're receiving advice from the government of Norway, which has the highest environmental and oil field safety standards in the world. We're receiving advice from them. We use their standards to regulate companies here, but a lot of things that need to be adapted. That work has been given out to a team of Ghanaian consultants working with some
Maritime Human Resource Ministry of Health to deliver the keynote address.
President and executives of GAQHI, our distinguished speaker, members of GAQHI, ladies and gentlemen, the minister was not able to come around because he's fine enough and his deputies also in mass. So I've been told to represent him. Unfortunately, I'm carrying some of these ideas, but not entirely. Okay, so the media will tell you when it's my role. The ministry recognizes the support of GAQHI in health delivery service in this country. They provide a lot of services in very relevant areas, in the mines and in the institutions where the industries are. We also recognize the fact that you're also going to train some of the members, actually train nurses, anesthetists, doctors, postgraduate. And actually people come out to say that they like the place where they go to. In other words, we are very warm with you, welcoming them, and the teaching is of high quality. Thanking you for that. We've also been participating in research and campaigns and the policies that the ministry actually put forth. The ministry, as a result of that, as a desk officer, Dr. Marty is here, and issues concerning private sector, and she handles everything. As we were asking for a desk officer for GAQHI. They will think about that, but for now, she handles everything. We also involved a number of things in this recognizing what you do in the human resource allocation. Anytime, I think you can attest to that, at any time, at the end of the year when doctors, nurses, and the various stakeholders and the health professionals come out, we invite your representatives and then we allocate them to you. To the minister's attention, the need to actually have a forum to be discussing the oil and gas industry in this country, which is very good. For some time it has not been something that we've been discussing, but that is what I see this forum trying to do, and we take it up. So once we've got an agenda, you are a policy community, so we expect a communique from here to set the direction for the agenda, and then we continue from there. The various health risks that we are likely to encounter, pollution, squatters will be around, fires, spirit, piracy, those ramified problems means that we need to prepare actually for them, if we've not done that. And then we need to get a policy direction for that. And that is where the collaboration with this organization actually comes handy. And I'm happy that we've come together to bring this agenda on board so that we can be discussing. What will be challenging you with, I was at the medical superintendent's meeting just last week, and I was telling that it's very good and important that every institution always have a vision of excellence. For me, your vision of excellence, wherever you are, should include the environmental sanitation and the fact that you are influencing the people. I would love to see that within 10 or 20 kilometers from wherever institution where you are, the place is clean. The attitudes are different, no pollution from vehicles and so forth, because we have seen the police to control that. Noise level is low. Most of the maritime health workers or hospitals see themselves on providing clinical service, and that's it. But to me, that doesn't show dynamism. You should be influencing the people around to do the right thing, so that when we come to your facility, we see that, yes, you have an influence. We are talking about oil and gas industry, we are talking about what they can do to support the environment. What about our own self? What are we also doing to influence the traditional rulers, influencing the teenage pregnancy, influencing sanitation? What are we doing about that? And I think it should be included in our vision of excellence. So please don't look back. You are on the way to the middle income status. That is how we should behave. I want to wish you successful celebration. And thank you very much.
Thank you very much, indeed. Dr. Apia, President and Executive Members of GAQHI, ladies and gentlemen. Now, I've learned something this morning which I never knew before, and that is when the President was making his statement, he said your institutions care not only for the staff of the place, but also people from outside can. I know there are a few institutions like Trust Hospital and so on, but I don't know if it is something that prevails throughout the society. If it does, then indeed you are actually part of the medical system in delivering health service to the people of Ghana, and this is very commendable. Over the field of both clinical and public health issues, and mentions particularly some of the problems that are bothering us and which they are looking at in your institutions, like malaria, maternal and child health, especially maternal health, HIV, diseases of affluence, and so on. And so this, of course, the only thing that I think he took for granted was the how